This medication is used to temporarily relieve symptoms caused by the common cold, flu, allergies, or other breathing illnesses such as sinusitis and bronchitis. Antihistamines help relieve watery eyes, itchy eyes/nose/throat, runny nose, and sneezing, while decongestants help to relieve stuffy nose and ear congestion symptoms. If you are considering using this medication, be sure to carefully read the package instructions to ensure it is right for you. Some products with similar brand names may have different active ingredients and uses. It's important to avoid taking the wrong product, as it could harm you. If you have any questions about this product or its use, ask your pharmacist for guidance. Cough and cold products have not been shown to be safe or effective in children younger than 6 years. Do not use this product to treat cold symptoms in children younger than 6 years unless specifically directed by a doctor. Some products are not recommended for use in children younger than 12 years. Be sure to consult with your doctor or pharmacist for more details about using this product safely. It's important to note that these products do not cure or shorten the length of the common cold and may cause serious side effects. To decrease the risk for serious side effects, carefully follow all dosage directions. Avoid giving other cough and cold medication that might contain the same or similar ingredients, and ask the doctor or pharmacist about other ways to relieve cough and cold symptoms. When taking Kindermed Kids Night Cold Cough 6.25 mg, 2.5 mg/5 ml oral liquid decongestants, it's important to follow the instructions given by your doctor or pharmacist. If you're self-treating, be sure to carefully read and follow all directions on the product package. You may take this medication with food if it upsets your stomach, and it's important to stay hydrated by drinking plenty of fluids unless otherwise directed by your doctor. If you're using the liquid form of this medication, be sure to measure the dose carefully using a special measuring device/spoon. It's important not to use a household spoon, as you may not get the correct dose. Additionally, if the liquid form is a suspension, remember to shake the bottle well before each dose. It's crucial not to crush or chew extended-release tablets or capsules, as this can release all of the drug at once and increase the risk of side effects. If you're using chewable tablets, be sure to chew each tablet thoroughly before swallowing. The dosage of this medication is based on the product you're taking, your age, medical condition, and how you respond to treatment. It's important not to increase your dose or take this medication more often than directed without your doctor's approval, as improper use may result in serious harm. If your doctor instructs you to take this medication daily, be sure to take it regularly at the same times each day to get the most benefit from it. If your condition lasts for more than 1 week, gets worse, or occurs with a persistent headache, fever, or rash, be sure to inform your doctor, as these may be symptoms of a serious medical problem. Some common side effects of Kindermed Kids Night Cold Cough 6.25 mg, 2.5 mg/5 ml oral liquid decongestants include drowsiness, dizziness, dry mouth/nose/throat, headache, upset stomach, constipation, or trouble sleeping. If any of these effects persist or worsen, it's important to consult with your doctor or pharmacist. It's important to note that if your doctor has recommended this product, they have determined that the benefits outweigh the potential risks. Many people who use this product do not experience serious side effects. However, it's crucial to seek medical attention if you experience any serious side effects such as changes in mental/mood, ringing in the ears, difficulty urinating, or vision changes. Additionally, seek immediate medical help if you experience fast/irregular heartbeat or seizures. While it's rare, a serious allergic reaction to this medication can occur. Seek immediate medical help if you notice symptoms such as rash, itching/swelling of the face/tongue/throat, severe dizziness, or difficulty breathing. This is not an exhaustive list of possible side effects, so it's important to consult with your doctor or pharmacist if you notice any other effects not listed here. Before using Kindermed Kids Night Cold Cough 6.25 mg, 2.5 mg/5 ml oral liquid decongestants, talk to your doctor or pharmacist if you have any allergies or if you have a medical history of breathing problems, diabetes, glaucoma, heart problems, high blood pressure, kidney or liver disease, seizures, stomach/intestinal problems, overactive thyroid, or difficulty urinating. This medication may cause dizziness or drowsiness, so be cautious when driving or using machinery. Limit alcoholic beverages and talk to your doctor if you are using marijuana. If you have diabetes, alcohol dependence, liver disease, or phenylketonuria, talk to your doctor or pharmacist about using this product safely. Before having surgery, inform your doctor or dentist about all the products you use. Children and older adults may be more sensitive to the side effects of this medication. During pregnancy, use this medication only when clearly needed and discuss the risks and benefits with your doctor. If you are breastfeeding, consult your doctor before using this medication. It's important to be aware of any potential drug interactions that could affect how your medications work or increase the risk of serious side effects. Make sure to keep a list of all the products you use, including prescription/non-prescription drugs and herbal products, and share it with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. Some products that may interact with Kindermed Kids Night Cold Cough 6.25 mg, 2.5 mg/5 ml oral liquid decongestants are antihistamines applied to the skin, such as diphenhydramine cream, ointment, or spray. Taking MAO inhibitors with this medication may cause a serious, possibly fatal, drug interaction. Avoid taking MAO inhibitors during treatment with this medication, and make sure to ask your doctor when to start or stop taking this medication. Also, inform your doctor or pharmacist if you are taking other products that cause drowsiness, such as opioid pain or cough relievers, alcohol, marijuana, drugs for sleep or anxiety, muscle relaxants, or other antihistamines. Check the labels on all your medicines, as they may contain ingredients that cause drowsiness. It's important to note that this medication may interfere with certain medical/lab tests, so make sure to inform lab personnel and all your doctors that you use this drug. If someone has taken too much Kindermed Kids Night Cold Cough oral liquid and is experiencing severe symptoms like passing out or difficulty breathing, it's important to seek immediate medical attention. In the U.S., you can call the local Poison Control Center at 1-800-222-1222. Canadian residents should contact their provincial Poison Control Center. Symptoms of an overdose may include irregular heartbeat, hallucinations, fainting, or seizures. It's important to take the recommended dosage and seek medical help if necessary. If your child's doctor has prescribed Kindermed Kids Night Cold Cough 6.25 mg, 2.5 mg/5 ml oral liquid decongestants, it is important to follow their instructions and not share the medication with others. Be sure to attend all medical and lab appointments as directed. If you are taking this medication regularly and you forget a dose, take it as soon as you remember. If it's close to the time for your next dose, just skip the missed dose and take the next one at your regular time. Don't take a double dose to make up for the missed one. It's important to store Kindermed Kids Night Cold Cough 6.25 mg, 2.5 mg/5 ml oral liquid decongestants at room temperature, away from light and moisture, and not in the bathroom. Make sure to keep it out of reach of children and pets. When it's expired or no longer needed, be sure to properly discard it by consulting your pharmacist or local waste disposal company. And remember, don't flush medications down the toilet or pour them into a drain unless instructed to do so. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.